Hi, everyone. Welcome to another webinar. I'm Shivangi from the oDoc team. It seems like everywhere we turn to or whoever we speak to, they seem to know someone who has tested positive for COVID. And all we hear about these days is COVID. With hospitals reaching maximum capacity and lack of hospital beds, the government now encourages those who test positive with mild symptoms and no underlying diseases to isolate at home. But what exactly is home isolation? How does one do it? How does the family have to prepare for it when someone at home tests positive? And how do you care for a patient who has just tested positive? To answer all this and many more questions regarding home isolation, we have Dr. Sabith Salieh with us today. Dr. Sabith Salieh graduated in medicine at the Royal College of Surgeons in Ireland and went on to complete his medical internship in Singapore. His postgraduate medical qualifications are in Master of Medicine in Family Medicine, obtained from the National University of Singapore, and international membership of the Royal College of General Practitioners. He is a family physician engaged in private practice and has over 14 years of experience in the field of primary healthcare. Thank you so much, Doctor, for taking the time to be with us today and to shed some light on a really important topic at this moment. So thank you, Doctor, for being here with us.
Hi, Shivangi. A very good evening to you all. It's a pleasure.
Thank you. So, Doctor, before I jump, I have a lot of questions prepared for you. But before I jump into the questions, I want to just let the viewers know that if you have any questions that you would like to ask Dr. Sabith, please send it to us via DMs or in the comments section below, and I will definitely ask him if time permits. So, Doctor, the first question is the obvious one also. So when a patient tests positive and is unable to reach the authorities like the MOH or the PHI right away, what must they do? What advice would you give such a patient? And what are the signs that they or the family member who's caring for them should keep an eye out for?
Yeah, so Shivangi, I think what I would like to start off with is just to explain that has been outlined by the Ministry of Health on their circular dated on the 4th of August, when they decided to shift from intermediate care facility for every positive patient to a home-based care option. Now, the Ministry of Health, they've made it very clear that once you are positive, you need to get in touch with your PHI, and your PHI will discuss the case with your area medical officer of health, and then they would decide whether the individual is suitable for home-based care or not, right? Now, if the patient is suitable for home-based care, what happens is they get registered in the PHIMS, which is the Patient Home Isolation Management System, right? And then the medical officer of health would hand over the care to a medical team that is led by a consultant family physician, and who will then contact the patient over the home isolation period, right? So this is what the Ministry of Health have planned on when they're talking about home-based care. However, we've seen in the last 1 to 2 weeks, the issue is that the PHIs are overwhelmed, right? They've really gotten their plates full. We must remember that apart from the huge increase in the number of COVID cases, they are also dealing with other PHI responsibilities such as dengue, right? Food hygiene. So they really are stretched thin, right? So what a lot of people or patients have experienced is after they've been tested positive is they find it difficult to contact their PHIs, right? They take a couple of days, or after establishing initial contact, they find that the PHIs, to get back to them with advice, sometimes there's a bit of a delay, right? So I think that's where the importance of having a bridging service comes in. And then this can be in the form of through a telemedicine platform, or a hotline, or a COVID hotline, or even just getting in touch with your family doctor, GP, or personal physician. So what the bridging service, what the goal of it basically is just to inform the patient once they've tested positive, what initial advice and guidance that we can give them until the relevant authorities get in touch with them, right? So I think that's what home-based care is about at this point in time. Now, once the patient, so as the bridging service, or as the initial doctor that a patient reaches out to when they're positive, we need to decide whether the patient is stable or unstable. If the patient is unstable, we tell them to go to the nearest hospital. But if the patient is stable and we feel that they're suitable for home-based care, then we give them some basic advice. So I think the first thing to remember is not to panic, right? Remember, I think a lot of us, we need to remain calm. We do make a recovery based on what we've seen, majority of patients do make a recovery without any issues, right? And especially if you are vaccinated, the complication rate, the hospitalization rate is much, much less than an unvaccinated individual. So I think remaining calm is very important. And then, of course, there are a few basic things which we advise patients in terms of hydration, right? To make sure that they adequately hydrate themselves, at least 2.5 liters of liquids a day, if you don't have any contraindication in terms of your volume. And we tell them, look, I mean, things like water, even oral rehydrations like Peditrel, Jeevani are good options. Coriander water or Kottamali is also another very good option. And warm liquids, take as much as warm liquids as possible. Steam inhalation, I mean, we advise them to do it or engage in steam inhalation maybe 3 times a day or so. Consume a healthy diet, right? So, and also we advise them to take a lot of food or fruits or vegetables that are rich in vitamin C, right? Now, in addition to that, I think it's important to understand that if you are a smoker, it's very important to stop smoking during this period, because the virus itself does a lot of damage to your lungs. And if you're smoking on top of that, it kind of exacerbates the injury. So it's very important until you make a recovery for 2 to 4 weeks that you don't smoke, right? Now, the other simple measures that we tell them is, look, a lot of them end up presenting with a sore throat, right? So the easiest home-based treatment is lukewarm water, putting in a bit of salt, as well as turmeric, or kaha, which is a very good antiseptic, and regular gargling of one's throat, right? And then in addition to that, they can use other measures, like some people use milk and honey, honey and lemon, right? Or black tea to kind of soothe their throat, right? But the other thing I would like to touch on is medications, right? So a lot of us, the moment we're positive, there are a lot of medication lists circulating in social media. Once you're positive, start taking these medications. So I thought I'll just share my thoughts on what relevant medications one should consume. So, I mean, we advise patients to take a multivitamin that contains zinc and selenium, if possible. Vitamin C, right? So 500 milligrams twice a day is very good to boost your immune system. Vitamin D, there's increasing evidence to show that if your vitamin D levels are optimal, your immune system works much better in terms of fighting and warding off the virus, and it has shown to reduce the risk of complications and in terms of disease severity. So vitamin D levels, I mean, some of us may have not tested our vitamin D levels previously, but a lot of us tend to have the vitamin D levels in the insufficiency or deficiency range, right? So what we normally recommend is, I mean, if you look at the vitamin D, the spectrum, normally it's 30 to 100 is considered the normal range. But evidence shows that if you have a level of more than 50, then your risk of fighting the disease or other complications arising from the disease is much less, and it really boosts your immune system. So we would recommend at least around 5,000 units, 2,000 to 5,000 units for about 2 weeks during the acute phase of your the infection, right? Now, in addition to that, the doctor may prescribe supportive management options or medications such as paracetamol, and some people, or Rapidine or Panadine, which is paracetamol and codeine, for your fever, body aches, and headaches. We generally advise patients not to take any other painkillers, especially those belonging to the non-steroidal anti-inflammatory group, right? And there'll be other medications that we prescribe based on the individual symptoms, right? I would like to highlight about azithromycin, because I see a lot of patients who have been tested positive, and they feel, and I know that there are a lot of social media circulars that say, okay, as soon as you're positive, on day 1 itself, start azithromycin. Now, azithromycin is an antibiotic, right? Based on current evidence, I think there's a paucity of evidence to show that if you start azithromycin on day 1 of your infection, it has, it doesn't reduce the disease severity, it doesn't reduce your complication risks or in terms of your mortality, right? So, I mean, there are a lot of studies that are ongoing now, which may later on show us in terms of whether it really works or not. But don't get me wrong, azithromycin, certain doctors, we do prescribe it during different stages of the illness. But what I'm talking about is starting azithromycin the moment you turn positive on day one, right? So it's important to practice evidence-based medicine. And what this will lead to is a huge issue in terms of antibiotic resistance, right? And that's something that, because if you just imagine every COVID positive patient being prescribed azithromycin, and we really are going to have a huge issue in terms of antibiotic resistance in the future. So before just starting the antibiotic, it's always good to kind of, do it in consultation with your doctor, and your physician will then advise you whether you need it or not, right? Now, in terms of your regular medications, you can just continue it. So for example, if you're a heart patient, a diabetic patient, or you're taking your thyroid issues, it doesn't matter. You can just continue taking those medications. That's very important. The other thing that I would like to touch upon is your monitoring system. So what we normally advise a person who is at home is, if they have access to a thermometer or a pulse oximeter, right? And of course, if some pressure patients who have a history of high blood pressure and diabetes, they may have a home blood pressure machine or a home sugar machine, right? If you do have that, that's ideal. But in general, if you have a thermometer, plus or minus a pulse oximeter, it's important that you monitor your temperature and oxygen saturation at least twice a day or even 3 times a day, right? This is important because what we advise patients is to look out for some warning signs, right? So, and that will help the doctor to be able to, whether there were any red flags, to kind of be identified at an earlier stage, right? Now, on top of that, if you're a diabetic patient, it's good that you monitor your home sugar levels, because sometimes when you have an infection, the sugar levels can go up as well, right? Similarly, your blood pressure. Now, when you talk about warning signs, I think this is very, very important for us to understand that whether there is a change in the pattern of your fever. That's what I tell patients. Look, when you're monitoring your fever, what do I mean by a change in your pattern of your fever? So somebody who starts the infection, they have a bit of fever, then they don't have any fever for a few days, right? And then suddenly, after about 3-4 days, they get a fever. That's a red flag, right? Or if you have been having fever, a kind of a low-grade fever, and then it spikes up, right? So that's another issue. And similarly, if you're having fever, say every 8-hourly or 12-hourly, not so frequently, and then suddenly you feel that the fever is becoming more frequent, right? And say, for example, you're getting it every 4 or 6 hours, right? So this is what we call a change in the pattern of the fever. So that's something you need to keep an eye out for. Change in your coughing pattern. So if you feel the cough is becoming more and more, or if you feel that you're getting a bit of chest tightness or breathlessness, right? Now, you remember, now when we were talking about monitoring your oxygen saturation, normally we want it, the room air, your oxygen saturation should be more than 96% in room air. And after mild exertion, it should not fall below 94%. It should be above 94%. Now, if say, for example, your oxygen saturation in room air falls below 96%, or after mild exertion, it falls below 94%, that is also a red flag. Having said this, I would like to highlight and tell patients not to be fooled by going only based on your oxygen saturation, right? Because your oxygen saturation, your lung has a huge capacity. We have a lot of reserves, right? So the oxygen saturation generally is one of the later signs that drops. So if you notice a change in your fever pattern, you notice that your cough is getting worse, right? And you feel that you're short of breath, even though your oxygen saturation reads 97 or 98%, you need to seek medical care. All right. Now, on top of that, the other symptoms or red flags or warning signs are a patient becoming more drowsy, or they feel a bit more lethargic and sleepy, sometimes confusion, especially in the elderly. When they have sepsis or an infection, they tend to present with these drowsiness, right? And of course, if they have any signs of dehydration, low urine output, or they feel very dry, right? These are warning signs. And if you experience any of these warning signs, it's very important that you call an ambulance, 1990, or take the patient to the nearest hospital, right? So because these signs indicate that the patient's condition is deteriorating, right? Now, when you talk about complications and why these warning signs are associated with complications, because we have to understand that COVID-19, generally one of the known complications is a pneumonia. Now, this pneumonia could be due to the COVID virus-induced pneumonia or due to a secondary bacterial infection as well. The other thing that we have to remember is when we're dealing with COVID infection is the infection itself causes a lot of damage to the blood vessels in the lungs. And as a result, a patient tends to get hypoxic. They can suddenly desaturate, right? So you will find patients who are actually very well, they don't have any change in their cough pattern, or they don't have any severe fever, and then but they suddenly desaturate, right? So due to those tiny blood clots in the lungs, right? So these are really the complications, right? Apart from the other complications associated with COVID, that you need to seek emergency care. But what you can do till then is, if a patient especially feels increasingly breathless, is there are certain positions that you can keep. Either they can prop them up on 3 pillows, have a small table fan in front, or have a fan in front of their face that helps them to breathe a bit easier, or get them to lie down in their prone position if they are able to do it, right? You can keep a pillow on the pelvis and just above with their head slightly down. That kind of helps them to relieve their breathlessness, right? So those are essentially what we kind of want to highlight and bring about to a patient, so that they are aware of the possible complication risks, and that they are aware about to know what warning signs they need to monitor and look out for.
Great, doctor. Thank you for shedding some light on really important things. And I hope everyone who's watching now knows what to keep an eye out for when you're caring for someone who's just tested positive. Going on to my second question, doctor, you mentioned about intermediate care centers, but at the moment, a lot of people are under the impression that as soon as someone tests positive, it's best to check into an intermediate care center to prevent other family members from contracting the virus. But obviously, due to the really high demand at the moment, it's quite difficult to find a room. What advice would you give to such patients? And also, at what instance should a patient seek intermediate care?
Yeah, so that's a very good question. I mean, at the end of the day, Shivangi, the decision for home-based care versus intermediate care is made by the medical officer of health based on the guidelines, right? But there is a selection criteria. So for example, people between 2 years, above 2 years, and below 65 years of age, right? And if you have a well-controlled, you could have multiple medical complications, in the sense comorbidities such as diabetes, high blood pressure, kidney disease, heart disease, but they should be well controlled, right? If they are well controlled, then potentially you could be managed as a home care. I mean, you're suitable for home isolation, but those patients who are in an immunocompromised state. So for example, what do I mean by an immunocompromised state? Those who have active malignancies or cancers, right? Who have organ transplant recipients, right? Patients with any immunodeficiencies like HIV, right? Or if you're on any or if you're taking any medications that can suppress your immune system, right? So for example, people on long-term steroids, right? Or chemotherapy, right? Those patients are not suitable for home-based care, right? The other thing, in terms of pregnant women, usually the cutoff is 24 weeks or less than 6 months, right? If you're more than 6 months, you're not suitable for home-based care. And your BMI. So when you talk about your BMI, your body mass index, we tell you it's what, for your height, what your ideal weight should be. And those patients who have a BMI of more than 30, then they are considered high risk, and generally they are not suitable for home care. Because the reason for that is we've seen that the complications of COVID are more in those patients compared to somebody with a lower BMI. And then there are also, you have to have your home environment needs to be suitable. So for example, what do I mean? The patient should be able to be isolated. He or she should be able to be isolated in a room, right? Preferably with an attached washroom, right? They should be able to care for themselves, or have someone who is able to care for them. And there should be kind of a communication channel open, where they can, either through telemedicine or some form of or through a phone, where they can be in touch, right? So these are what we call the selection criteria for home-based care. Now, if a patient does not meet the criteria, then they're considered high risk, and they should be admitted to an intermediate care facility. So to answer your question, what we are seeing now, or what we have seen in the past, is a lot more patients who are suitable for home-based care, seeking care in intermediate care facilities. And I think that's what we need to advocate and say, look, if you are able to be managed at home and if you're suitable for home-based care, then we would prefer if you could do that, because then you're saving a bed and you don't occupy a bed unnecessarily. And somebody who is in the high-risk group who really needs it could get a bed easily, because what is happening is we're seeing patients who need to wait for a day or 2 or even 3 days to get a bed at an intermediate care facility.
Got it, doctor. Really makes sense. Thank you for that. The third question is, if a person in the household tests positive and the rest of the household has been vaccinated, does that mean that the other family members are less likely to contract the virus as opposed to someone who hasn't been vaccinated? And is it safe for such a person to take care of an infected person?
Yeah, so it all depends on the time of vaccination, you see, and the time that the person receives their second dose. So for example, usually it takes 2 weeks after your second dose for your neutralizing antibody levels to reach a peak, right? So if you are fully vaccinated, yes, the risk of complications. So let me put it this way. If you are vaccinated, you still could contract COVID. You could still transmit it, right? So it doesn't mean that you can't get the disease and you can't transmit the disease if you're vaccinated, right? But when you compare it to an unvaccinated person, the risk of complications or the need of hospitalizations in a vaccinated individual plus the transmission risk is less than an unvaccinated individual. So whether you are vaccinated or unvaccinated, when dealing with a positive patient, you still have to follow the necessary guidelines or or what we call personal protective measures to ensure that you don't contract the virus.
Right, doctor. Thank you for that. What advice would you give family members of a COVID positive patient with regards to isolating and testing, most importantly?
Right. So what you're talking about is a positive patient, the rest of the household members, right, in the family. Right. So what happens is once the patient turns out to be positive, generally the PHI would advise that the rest of the family household members get tested, right? Now, if they remain negative, right, then they have to go through a period of home quarantine, just as the patient, right, similar to patient, and it's 14 days from the date of the patient's positive, either the rapid antigen test or the PCR test, right? So during those 14 days, if they do develop any symptoms, then they need to get a test again, right? But if they don't develop any symptoms and they remain asymptomatic for the home isolation or home quarantine period, at the end of the 14 days, we usually recommend that they undergo what we call an exit antigen test before we allow them to go back to their normal lives.
Right, that makes sense, doctor. Going on to the next question, does a COVID positive patient need to repeat any form of testing like antigen or PCR at the end of their home isolation period in order to be certified non-infectious? Like how does someone know that they're non-infectious?
Yeah, so actually, no, they don't need to repeat it. So if a person who's positive, after a 14-day home isolation period or quarantine period, as long as they don't have symptoms in this sense, as long as they don't have fever for 3 days, right? And they don't have any worsening of their symptoms, right? Then they are considered non-infectious, right? And they can go about business as usual without being subjected to a test. So we don't advocate testing patients, positive patients, 2 weeks after their home isolation period, because certain PCRs may remain positive for weeks or months post-infection, right? And it doesn't mean that even if your PCR is positive, it doesn't mean you're infectious, right? So unless, of course, the patient during the home isolation period still has a fever at day 14, right? Or develops a complication, then potentially the patient is still infectious and then needs to seek relevant medical care and will not be able to end the isolation. Maybe they may have to have an extended period of isolation.
Great. Thank you, doctor. We've got like a few questions via our DM section. One question reads, when should we buy and keep oxygen cylinders? Like for what kind of patients?
All right. So you see, the thing, I know a lot of people are inquiring into getting oxygen facilities at home and all to keep some, so that at least they can be given nasal oxygen. But that's a bit of a tricky situation, because if you are not medically trained, right, and if you have no medical training, you putting a patient and managing a patient at home with just oxygenation is very dangerous. So if the patient requires oxygenation, so we go back to our red flags, right? So if the saturation drops and the patient requires oxygenation, it's very important that they receive that treatment in a hospital, right? And because managing the patient at home, because when that desaturation, we need to see what is causing that desaturation. Is it a pneumonia? Is it due to the blood clots? And based on that, it's not just about giving oxygen. There is another, they have to receive a lot of other investigations and treatments along with the oxygen. So it's not just about giving the patient supplement oxygen, and that's not going to cure and push up the saturation, right? So you have to we have to consider whether the patient needs steroids, whether the patient needs antibiotics, and whether the patient needs any anticoagulants, right? And all of these things need to be administered in a medically, in an environment, in a hospital setting, basically.
All right, Doctor. Thank you for answering all our questions. We've covered most of it. So we've come to the end of our session also. So once again, thank you so much, Doctor, for taking the time out of your busy schedule to answer some of the most important questions, and questions that a lot of people have, and they don't really have access to answers from a medical professional. So thank you once again, Doctor, for taking the time.
It's a pleasure. Thank you. Thank you very much.
Thank you. And to the viewers, we will be back with another webinar session in a few weeks. If you would like us to explore any particular topic, please do let us know. And if you would like to consult Dr. Sabith, if you have any questions for him that you would like to ask in a more private manner, you can always consult him via oDoc. So until the next webinar session, it's me, Shivangi, signing off. Thank you. And everyone, please be safe and stay home unless extremely necessary. Thank you.